Whenever somebody has a significant injury to their wrist, the treatment definitely depends on what that injury is. So when there's a wrist fracture, we have to consider is it displaced or has it shifted, and is it stable, and does it involve the joint, because that's very important for motion. So if certain criteria are met, then the patient would benefit from an operation to stabilize the wrist fracture. There's a lot of different ways to do it. The way that we do it depends on what the fracture pattern is. Most commonly, we make an incision on the front of the wrist and we fix the fracture into anatomic or normal alignment, and we stabilize it with a metal plate and some screws. The purpose of that is to get people their motion back quickly and preserve them some motion for use of the wrist in the future. Sometimes fractures are more significant and require more extensive fixation. For instance, maybe a plate that spans the wrist and needs to be removed in 2 to 3 months, and that's reserved for those more severe fractures that have a lot of what we call comminution, or a bunch of fragments of fracture. And in the more severe circumstances, we do that not uncommonly. There are many wrist fractures that don't require operative fixation. In that case, we put a cast on it, and then eventually the cast comes off and people work with occupational hand therapists to regain their motion and regain their function. But in general, patients with wrist fractures do very well, but it takes them a while to get back. Particularly motion and strength take a while to get back. But once they work with the therapists and work out a lot of their stiffness and get their grip strength back, patients are very happy.